Now for the next type of drug which you'll be looking at, which is a cephalosporin. Next example of the cephalosporins which we'll get to discuss is ceftriaxone. And ceftriaxone happens to be a very popular cephalosporin, right? So for ceftriaxone, we said that it's a third generation cephalosporin antibiotic. So it's widely used for its broad spectrum activity, all right, and it has a long half-life. So that means it will stay more in your body, okay, fighting the infection for a longer time. So for mechanism of action, it works by what? Stopping the bacterial cell wall from developing optimally. So the cell wall is not developing fine, so the bacteria is now vulnerable, it's having a weak cell wall, you know. So you usually disrupt the final transpeptidation step in peptidoglycan formation. So it will lead to the cell wall being very weak and not stable, okay. So spectrum of activity is effective against a lot of bacteria: Streptococcus pneumoniae, Neisseria gonorrhoeae, Neisseria meningitidis, Haemophilus influenzae, Escherichia coli, Klebsiella pneumoniae, Salmonella species. So a lot of bacteria. Okay. So pharmacokinetics, it is administered through the veins or through the muscles because it has a poor oral bioavailability, right? Has an excellent tissue penetration, including cerebrospinal fluid, especially when meninges are inflamed. Protein binding is high, around 85 to 95%. It undergoes minimal metabolism and is excreted via both the renals and the bile routes, okay? So it's suitable for even patients that have renal impairment, so it can still be excreted through the bile route. Elimination half-life is around 8 hours, okay? So clinical uses is used in treating pneumonia, meningitis, gonorrhea, pelvic inflammatory disease, urinary tract infection, sepsis, intra-abdominal infections, and it's also used for maybe surgical prophylaxis, okay? So that's what we got here for ceftriaxone.